Welcome to episode number 8 of the Lebanese Physicians Podcast. And today I have two very special guests. Dr. Chady Sarraf, who is the president of the International Lebanese Medical Association in the USA, and Dr. Salma Makhoul Ahwach, who is the media committee officer at ILMA-USA. So welcome Chady and Salma. And
Thank you, Khalid.
I'm glad you are both on the podcast today. So, Chady, can you tell us a bit about yourself and how you ended up here in the U.S. At this point?
Sure. Thank you, Khalid, for having us. That's a great opportunity for both of us to talk about ILMA-USA. So this is Chady Sarraf. I'm a internal medicine. I work as a hospitalist, and I'm the medical director for the hospitalist group in the Via Christi hospitals in Wichita, Kansas. You know, I came to the U.S. in 2005, started my residency in New Jersey, Seton Hall University. I did internal medicine. Then I worked 3 years in the state of Maine as a hospitalist, then moved to Wichita, Kansas in 2012. I've been here since then.
Excellent. And Salma, can you tell us a bit about yourself?
Yeah, hi. Salma Makhoul Ahwach. I graduated actually in 2005 from Lebanese University, decided to do my residency at AUB and then of internal medicine. And then I decided that I want to come to the States. So I came in 2009, did my residency at Henry Ford Hospital in Detroit. Then did my fellowship in endocrinology in University of Florida, Jacksonville. I practiced for 6 years in Wichita, Kansas, and now I moved back to Jacksonville because this is where I consider it home. So I'm now an attending at St. Vincent Ascension in Jacksonville, Florida. So it's going well for now.
I guess that's where you have the connection with Chady, right, in Kansas?
No,
sure,
actually, Chady is my classmate from the Lebanese University.
Yeah.
We did the 7 years of medical school together.
All right.
So Chady is a very, very good friend of mine since Lebanon. And then we ended up doing our waiver together in Wichita and kind of reconnecting there with him and his family and everything. Yeah.
Yeah.
Right. And so how do you guys decide to develop the International Lebanese Medical Association, the USA chapter, I guess, where you're just like talking on the phone together and you're like, wow, that's a good idea. Let's develop ILMA, or how did it come to be?
I think, it started back in around April and May when Dr. Walid Ahmar, he's the president of the ILMA International. He started with looking for physicians from the USA to share their experience with COVID and to go on a global webinar that has physicians of Lebanese descent from all over the world in a collaboration with a physician in Lebanon and talk about COVID. So I was connected through a friend with him, and this was my first exposure with international ILMA. And I was really amazed how the webinar was run and just meeting health professionals of Lebanese descent from all over the world who cares about Lebanon and talking about their own experience. If you remember, that time was a big peak in Italy and Spain, and we have doctors from there talking about their experience too. So it kind of clicked in my mind that really we lack something similar here in the US. Then Dr. Ahmar kept, talking to me about, maybe we should start something like that. We had a few providers in the US, including Dr. Francois Bifado, and we were both kind of thinking seriously about starting something up. And then around probably late July, early August, we connected with Salma, and we thought that really we need to start it and see what happens. And we thought that, it's going to be all good. We are in need of something like that, a association that, connect all the Lebanese of healthcare professional who live in the US or work here together, and hopefully connect with the world and Lebanon. Salma, what do you think? Is that right?
Yeah, I think so. I think initially you created the WhatsApp group, started adding a few physicians to tell us about ILMA and everything like that. And at that time, I think me and you connected since I'm the social media queen.
Right,
I was
right.
like, can I help
We
you,
were
you know,
in,
start a Facebook page and maybe a website and everything like that. And then we started connecting more and more about
yes,
it around August, I think. And we started recruiting more people. We worked on the Constitution, applied to make it, you know, official in the United States and everything like that. So me, Chady, and Francois, I think were the kind of founding members. And then we
yeah.
started recruiting board members and everything like that. Got finally registered in December of 2020. And we're growing like crazy since.
Yeah.
So it's been really nice.
Yeah, right.
And that's very true. Yeah. I'm sorry, Khalid, but you know, me and Francois, we needed someone like Salma, like, you know, kind of be the engine of this, you know,
The
from the
dynamo.
start going, dynamo, yes. And you know, when we talked to Salma and I talked to her, you know, on and off, I can tell she had the spirit. She had the same ideas about like we are in need of something like this to help our country and connect with each other. So it didn't really take much to convince her, you know, because she was already on board with that mentality and the need for such an association.
Yeah, I think I've been like waiting for this like for years, you know, like to like connect with everyone like from here. And I think it has so much opportunity to help and like to connect between Lebanese professionals here and in Lebanon. And I felt like the minute I saw that you're starting this, I had to like jump on board because I felt like this was an amazing idea, honestly. And
Yeah,
we're seeing it now, you know, we're seeing like how it's changing things and everything like that. It's really nice to start seeing some, you know, some change. So it's really nice.
right. And he jumped on board very well, I guess. I mean, she's a dynamo for sure. I mean, we see WhatsApp messages from Selma at 10 p.m., 11 p.m., 6 a.m.
All the time,
I'm
exactly.
very dedicated, you know, I'm very dedicated. It's taking me away from my family a bit, so I need to slow down a bit. But I love the association, honestly. Like, I just love it from all my heart. Like, I love everyone there. We've been doing like a great job together, and everyone has been so nice and supportive. I think we've needed this for a while, and no, I love it. I love doing everything that I'm doing. Chady is an amazing president. All the board members, you know, including you, Khalil, have been really working really hard on this. All of us have been seriously like putting a lot of time and effort into this, and it's nice to see the final product.
Yes,
That
exactly.
it's still going to be like growing and growing, honestly.
Yeah, I mean, things have been moving really fast, I guess. I mean, 3 episodes ago, I had a podcast with Francois Abifadel, and he mentioned it to me, and then things rolled very quickly from there. I mean, I talked to Chady, and then suddenly I was on the board and doing videos
Yes.
and all this stuff. And yeah, speaking about videos, I mean, this was a big project. I think you guys thought of was doing the COVID-19 vaccination videos promoting the vaccine for Lebanon. So how did this idea come about or come through?
Chady, you want to answer this or you want me to answer?
Yeah, I can't remember how it started, but you know, obviously me and Francois and Salma and the board who we were had at that time, you know, we're trying to brainstorm how we can, send more education to our beloved, families and friends in Lebanon about the vaccine and how we can uh, promote the vaccine because there's a lot of conspiracy theories and wrong information that has been, uh, changing people's mind and creating fear about the vaccine. So really, I think we're all looking for something to do and I can't remember how the video, but we thought that shooting a short videos from practicing physician in the USA who took the vaccine and explaining, in scientific way what are the vaccine, why the vaccine is important, what are the benefit of the vaccine, and basically make it really short and to the point. We felt that would be the best way to support the healthcare system in Lebanon, the physicians in Lebanon, and of course the Lebanese population.
Great. And Selma, do you have anything to say about it or?
No, honestly, I feel like it was kind of a spontaneous thing initially because we were talking on the group and we were very frustrated about the amount of misinformation that's getting to Lebanon through media, basically. So we thought the best way to kind of counteract those misinformation is to get something quick that might go, viral, which it ended up doing, is a bunch of physicians telling the truth, telling scientific facts, to remove these misconceptions. And I think, honestly, it just came out like everyone was brainstorming on the group, and we came out with like, why don't we do a video? Yes, why don't we do a video? And we got a few volunteers and everything like that. And then the idea started, and we did the video within 1 to 2 weeks with the help of all the volunteers, including you, Khalil, and one of Chady's friends helped us edit it, and we posted it on Facebook, posted it on WhatsApp, and then within, seriously, like 4 hours, we were having people texting us that don't know us, basically, from Lebanon, saying, oh my God, like I saw your sister here, and I saw Chady here. And it circulated super quickly in Lebanon, which means it was very needed. Just like everything circulates with misinformation, also the right information can circulate on social media. So circulated very quickly. And I think, at least from my standpoint, I feel like some of my family members that I know have called me and said, you know what, we were kind of on the fence about this vaccine, and now seeing doctors from the USA take it has kind of, convinced us we're going to get registered on the platform of the Ministry of Health, and we're going to get it once it's available. So the more people we can convince, the better. And we still have some projects, as you know, Khalil, to try to kind of, convince more people to get registered, to get the vaccine, hopefully when it's available, to try to kind of, curb this pandemic, basically. I mean, hopefully we're making that change a bit.
Right. I mean, it spread very quickly. Like the next day, I was getting friends from Lebanon calling me, telling me, we just saw you, and sending me the video. And but I think I agree with you. I think it's made a difference. I've had a lot of people like ask me, should my mom take the vaccine? Should my dad take the vaccine? I think that's probably helped, hopefully, in increasing registration on the Ministry of Health site over there for people to get the vaccine. Because as you know, I think registration is still low. I mean, the availability of vaccine is getting more, but registration is still low. And I think there's still a need to keep promoting.
Keep implementing, keep educating, keep that discussion going, keep those questions going, so we can know what the fears are and what the misconceptions, and kind of addressing them as we go. And it's a process, like this vaccine is we're going to be bringing more and more dosages over the next few months. So it's not just one video, it's keeping that education going over the next few months to try to convince more and more people to get it, and hopefully making a real change, along with the physicians in Lebanon that are really trying to do so too.
Right, they're working hard over there to do so at the same time. And I think they've posted a lot of photos of themselves getting the vaccine there too, to try to promote it, which is a good thing. So the other thing I see is like the membership of the group over the past month or two has exploded, and which is I guess a good sign, because there's a lot of physicians in the U.S. And now they're getting connected together. So what do you see ILMA-USA, I guess, and ILMA International, I guess, doing about this big membership at this point? What are the next steps or next plans, I guess, outside of the COVID-19 promotion and others?
We believe there's at least 3,500 physicians of Lebanese descent that are practicing in the U.S. And this is by the AMA data. We're not even counting the people who are born here from Lebanese parents, or they did medical school here. So this is one of the greatest potential we are seeking, is to connect those physicians together. In addition, we're not even counting other healthcare providers like dentists, pharmacists, any person who works in the healthcare. So that's why I feel the potentials are limitless at this point. We're a big country here. Our first goal is to connect and build a solid and organized network, so we can get people to connect together. And you're right, as you said, Khalil, exponentially went up, and we are anticipating even more. Every person I talk to on the phone to tell them about ILMA, I think 99% of them, they had the same idea. Like, we need something like this. We need an active association that is run by people who are motivated and connect to each other and try to provide avenues to help each other and help trainees coming from Lebanon, which is one of our project is if trainees in medical school or pharmacy school or maybe dentistry school, they want to come to the US to advance their training. We want to try to help them. I know you are leading the trainees committee here in the US, and you're doing a great job so far. We probably have more than 100 members already. So we're trying to do to address multiple level. But I think once we are settled here and we are better organized, this is where we're going to probably start working our relationship internationally. And we did already some collaboration with other associations like in Australia, in Sweden, in Belgium, and France. They are all well-established association of the ILMA, and they're pretty active and very well suited.
Yeah, it seems so. It seems like the new recent article that we saw that they donated $2 million of medical equipment and supplies to Lebanon recently, which I think is a big feat just coming from a group of physicians.
Exactly.
And I think that the bigger the group, probably the bigger the impact will be.
100%.
Yeah.
And I just gotta tell that as an association, we don't have only one project or one goal. It's really everything we can do to connect the healthcare provider in the US who have some bonds to Lebanon or from Lebanon originally. Then do academic work like conferences, webinars, help trainees and to advance in their training, help students who want to come from Lebanon to here, and of course project our work and our help to the healthcare system in Lebanon. So if you can help with anything we can to support the healthcare system in Lebanon, because you want that to be sustained and to continue to work, because if that's collapsed, that's going to be a disaster in this country. So we want to help them. That's what the Australian chapter did. They sent this $2 million of equipment donation to support the hospitals there and the healthcare system there. Right.
And I think we've been utilizing, since Salma's here too, we've been utilizing media a lot for this. And Salma, can you talk a bit about like the impact of social media, I guess, and how it spreads information these days?
Khalil, I'm someone who believes if you use social media to a benefit or to a good cause, it could be very useful. But on the other hand, if someone who shouldn't be there is using it too, it could be very harmful. So we see people going out giving us advice about vaccines and everything, who are singers, let's say, who shouldn't be giving us advice about vaccines, right? So the impact on especially the Lebanese population or any population, anyone who's a regular person, they're not a doctor, they can be super educated or not, are on social media these days. And unfortunately, they're not getting their information all the time from their doctors or from Mayo Clinic website or whatever. They are on social media, they are on WhatsApp, they are on Facebook, getting their information from their neighbor or from their friend. So it is creating a lot of impact, whether positively or negatively, on these people. So what we're trying to do is to use those platforms positively. So use them only to propagate the right information and everything like that. And I honestly think it will have a huge impact, So we're trying to utilize all platforms. So Facebook, Instagram, Twitter, as you're helping us with Twitter, to try to get, and I mean, we're growing, we're going to get more and more numbers, on those platforms that will be listening to us. Will we change everyone's mind? No, but we will change some people's minds, whether it's about COVID-19 now or in the future about further education or about maybe even starting fundraisers in the future when we are, an association that might be able to help, financially or with medical equipment. The easiest way to raise funds now, as you know, is GoFundMe. So, I mean, these platforms are going to be super helpful for us now and in the future in any project that we have to propagate the right information, to ask for help, to organize webinars with Lebanon. So that's the way to go, I think.
I agree. And I think it's social media is a double-edged sword, I guess. Yeah. You can spread information very quickly, and therefore you can connect with people very quickly, but at the same time you can also spread misinformation very quickly.
Exactly. And that's why you
Exactly.
have to be very careful about what you spread and what you say. And that's why even the video that we did as a COVID-19 campaign, we, with the help of Dr. Maha, who's an ID specialist, she helped us, formulate all these questions to be completely and very accurate and very scientific in our information, so we don't spread zero misinformation about anything.
Right. And we saw that, a lot in Lebanon, with some people spreading misinformation very quickly on social media and on regular media interviews too. So
it's very easy to spread the fear. It's harder to to spread the scientific words and
Absolutely.
right information. But fear, it's spread very very fast. And honestly, I can tell you, my family members will reach out after they hear those conspiracy theories about the vaccine and ask me, like, is that right? Is that true? And unfortunately, you have to re-educate and assure them that was the right thing to do.
Right. Yeah, and there was a nice picture of you, Chady, that we just saw on Zoom.
Oh, I'm sorry, I had somebody calling me.
At least it was a good picture, not like.
And so how do you expect, I know we all know the situation in Lebanon right now is unfortunately on multiple fronts not good economically, COVID-19 wise, and even after the explosion happened. So how do you see that the organization will be supporting Lebanon moving forward with a lot of the things that are going on there?
I think good part of the growing in our association is what's happening in Lebanon. So a lot of people really felt that this association will be the right platform to help our country and the professional platform to be able to provide training or medical expertise or even webinar conferences. I can't say more how we all aching about what's going on in Lebanon, and it's heartbreaking, really. I mean, people are losing their jobs, their futures. The economic situation is horrible, and you add to this the COVID pandemic on top. It can't get worse than that, and that's why really we're trying to build a organized and structured forms to help. And as I mentioned before, help the trainees come in here, try to hopefully organize some fundraising down the road to help with medical equipment. We have some projects like at smaller scale to maybe share expertise through remotely, through Zoom or telemedicine to support the clinics there. You need, this country needs help at all levels, and we're trying as much as we can as professionals to support the needs. And if you think, with the way we think about it, is we are part of an international organization too, and that's why we want to work with other associations and see how we can help them, and they can help us to help Lebanon.
Yep. Salma, do you want to say anything, or?
We are a bit above 200 members now, probably 250 members in the association. But imagine the impact we're going to have when we're a few thousand. I think we're starting with small projects because honestly, at this point, you don't know where to start to help, because you can, there's a huge amount of need in Lebanon in everything at this point: medical supplies, money, COVID vaccines, medications. So honestly, there's a huge need for help. And I think, like Chady said, down the road, we have to start thinking about, more fundraising and everything like that once we're registered as a foundation, basically, which we're working on. For now, we are helping with medical expertise if we can, where we can. We are trying to help trainees if we can, starting projects. We are, like he said, trying to work with ILMA Australia and other ILMAs around the world to help with, fundraising and everything like that. So we're trying, we're starting, but I feel like as we grow, we're going to be more impactful, and we're going to be able to do more. And, you know, in Lebanon, unfortunately, this crisis is not going to disappear immediately, no matter how much hope we have. But to be realistic, I mean, on top of COVID, the economic crisis is going to take years maybe to recover, if we ever recover. So I feel the road is very long for recovery, unfortunately, which is, like Chady said, our hearts are aching all the time, and we're trying our best to do whatever we can, whether individually or through the association, to help. So I think that we have a long road ahead, and I think we will have more and more projects as we go, and more ways to help as we become bigger and become more impactful as an association.
Right, right. And I have one last question for you both is, how are your spouses taking it? I mean, all these long meetings after work and all this stuff. Chady.
Let me start. So my husband is very, very supportive. He's very nice, but I think I'm pushing him to the extreme of his patience. He just gives me one look. He's like, yesterday he was like, how long is this meeting going? Can I go to the bathroom? And I'm like, oh my God, it was a 3-hour meeting. Poor guy. He was just waiting for me to finish so I can watch the kids, so he can go to the bathroom. So he's super supportive, I think, and he's very proud, to be honest. Like, he keeps on telling me, I'm so proud of you. Like, you're finally on top of medicine. You're finding something that's so satisfying for you, because you cannot imagine how satisfying this is for me. I love connecting with everyone. I love the potential of us helping Lebanon. And I think I found my new goal in life with ILMA, to be honest, not to exaggerate, you know. I feel like, you know, I'm doing something super useful right now. And he is being very supportive, but sometimes, I mean, obviously, I need to put my phone down and concentrate on the family. So we've been trying to do that recently, to try to kind of cut back on, you know, time on the phone and everything like that. But I think, I don't know, I know Chady's wife very well. I let him talk about it. I know how supportive Jihan is too. I mean, and how proud she must be of you. You know, you're leading this huge group, and I mean, you're doing an amazing job. Personally, I'm so proud of you as a friend, and I'm sure, I mean, Jihan is super proud of you. So I'll let you talk about that.
Yeah, the same thing, you know, is super proud, but to some, you know, some extent, you know, I was already pretty busy in my work-life balance, let's put it that way. And she's been always supportive. She's a physician and she knows, but the ILMA is a totally different level. You know, I'm a medical director. I'm on a board for the local county, on a national task force with the healthcare system I work with. So I already have a busy life and pretty active, and she's been always supportive, but this is totally different level. And we're talking about something we built, and we're probably going to pass it on to other people in the 3 years, and it's going to last for years. And as Salma said, you know, we're so proud of it that, you know, it's a very good cause that you really, it's worth the sacrifice of time. And probably my kids will be proud of me and everybody when they know why we spend away times from them doing this. It's really good cause. And actually my oldest daughter already learned something, and she actually thought, you know, when we talked about why I'm doing this and how we can help Lebanon, she started, you know, baking cookies and sell it in school to fundraise and send to Lebanon some money. So you know, it has to be for something, and that we're doing. And I'm very proud of the team we have here, you, Khalil, and Salma, and everybody else. You know, me and Francois, we brainstormed for many months before we launched it, and it's going to be a great association down the road. Now it may take a few years, but that's fine. I mean, everything we do is going to impact and be positive. So I'm very proud of what I'm doing, and my wife is.
It's so nice that you're teaching your children, Chady, through example, and still connecting to Lebanon too. Remember, our kids are now full Americans, you know, first generation, and seeing you care so much about Lebanon is going to keep that connection in their heart too. So It's really nice. I didn't look at it this way until you said something about your eldest daughter. So, I mean, it's so nice.
Right. It's a very good connection to have, I think. And it's always good to have the kids appreciate that they have two different cultures, I think, that they
Yes.
Exactly.
yeah, and so thanks to you both for being here on the podcast tonight. And I think we need to also thank like all the ILMA board members. And I know I interviewed Dr. Abifadel Francois a couple of podcasts ago. He's done tremendous work in the organization, and all the other board members. There are a lot, so I'm not going to mention all the names right now, but thank them all. And at the same time, too, I think I really, I always think whenever I do these podcasts and I talk to some of my friends back in Lebanon who I worked with, some physicians are still there. They're still fighting it on despite the situation. Although I know a good number of them have the opportunity to leave, but they don't want to leave because they want to fight it on. And I think I respect them too. And I think hopefully we'll be able to work with them to help with the situation over there.
I agree. And I want to, again, thanks everybody on the board. And remember, Khalid, when we talk and you jump on board to be a board member, it's all volunteer based, and everybody else did the same. And they saw the same thing. Like that's a good cause. It has a lot of potentials, and it's the right thing to do. And that's what's amazing about our board and everybody else who's joining us. They all believe that there's going to be something good coming out of this, and I'm sure it will.
Yep. Thanks.
Thank you.
Thanks.
Thank you, Khalil.